We're here at TMS of Tampa, a depression treatment center with Dr. George Northrup, who utilizes transcranial magnetic stimulation, which uses highly focused MRI-strength magnetic pulses to stimulate the brain and treat major depression. Thank you for having us, Dr. Northrup.
Thank you for being here today.
So let's just start with depression as a whole. What's the clinical definition of depression? And also, why do you think it's such a problem in America nowadays? So many people seem to be suffering from depression.
Well, I don't think it's just a problem in America. Depression is a widespread disease throughout much of the world. Typically, it's a cluster of symptoms that include low or sad mood, tearfulness or out-of-the-blue crying spells, irritability.
Other symptoms of depression include lack of energy, motivation, concentration, muted interest, and the inability to enjoy life.
How do you know when you're not just having, a bad day versus truly suffering from clinical depression?
Anybody can have a bad day, but when a bad day becomes 2 bad days and 2 bad days becomes 2 bad weeks, and you continue to feel that way, you know something's wrong.
I was diagnosed with depression as a teenager. I'm approaching 40 now. But to answer the question about having a bad day, things like that, it's certainly much, much deeper than that. And a lot of people think of depression as, oh, woe is me, I'm sad. It's not really like that. For me, at least. It could be like that with other people. The way I would describe my depression was just sort of apathy, and nothing really interested me. I didn't really care about anything.
Dr. Northrup uses a simple question to help people understand the difference between occasional sadness and depression. He asks, what do you do for fun, and why aren't you doing it?
I used to fish, and when's the last time you went fishing? And I've had people tell me answers like 5 years ago. I'm like, well, what's keeping you from doing that? I don't know.
The old adage of depression being a neurotransmitter deficiency is a gross oversimplification of the problem. It's used as a convenient way to describe what is happening to the general public. But the true cause of depression could have a number of factors and could be either too much of or too little of a substance, rather than just simply too much serotonin.
A common treatment for depression is medication. While prescription drugs still work for a majority of people, others suffer intolerable side effects, or the drugs simply don't work for them. This is where transcranial magnetic stimulation, or TMS therapy, is different.
We now have better treatments, one of which is TMS.
While most people improve with prescription drugs, the paradox is that, for a small group, the medications may actually increase pessimistic ideas, including thoughts about death and dying, or being okay with not waking up in the morning. This is especially true in children and teens suffering with depression, as they tend to focus on death and dying.
The vast majority of people experience a decrease in their pessimistic thinking and thoughts about death and dying, whether it be passive thoughts like, it would be okay if I just didn't wake up tomorrow, which is actually a very common thought process in people with depression.
TMS is often used as an adjunct to medications, with the goal of eventually getting patients off their prescriptions. Or if a person has adverse effects from medication, TMS can be used as a standalone treatment.
If a person's had a number of medication failures and doesn't tolerate them, we could certainly do TMS as a standalone treatment. Essentially, we create a strong electromagnetic field, which induces an electrical current in the brain.
Electricity is how parts of the body talk to one another.
As an organism, we are essentially just a collection of salt, or ions, and places for them to move. Everything in your body happens is either an electrical, a chemical, or an electrochemical response.
Brain mapping is when doctors use anatomy to find the brain's motor cortex, which is the area that creates movement. Mapping that portion of the brain gives doctors a visual clue. This visual is a proxy for the doctors to retarget the placement of the magnet on the head to reach the portion of the brain responsible for emotional regulation.
Earlier, we put Ethan in the chair and actually elicited a thumb twitch from him, which is how we do the mapping. We then use that as a proxy, right? So we move a certain space from that to reach the center for emotional regulation that we want to treat.
Doctors place the device on a patient's head and send a pulse, which triggers movement in the right thumb. They use this as a landmark, since the motor cortex is close to the emotional regulation center of everyone's brain. Using this information as a roadmap, doctors then move the device to the appropriate area of the patient's head.
How long does it take to actually map someone's brain?
So it can take anywhere from a couple minutes to up to an hour if we're having a particularly difficult mapping.
Once mapping is complete and a precise location is found, doctors proceed to the actual treatment position to deliver the electrical pulses.
Now, it's a train of pulses with some interruptions, so people affectionately refer to it as the woodpecker. Because what you get is a tap, 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 tap.
And what it felt like, Kimberly, was almost like a puff of air.
Some people find the treatment mildly uncomfortable, but after a few sessions, they typically acclimate to the sensation.
Each treatment is 17 minutes and 45 seconds, with the pulses being delivered at very specific intervals.
Dr. Northrup finds the treatment effective for his patients and often hears how the process gives them their life back. He finds this personally rewarding as a physician.
It's just one of many things that people said to me, you know what, I forgot what it was like to enjoy doing something. So this has been tremendously rewarding.
Treatment courses are typically 36 sessions over roughly 6 to 8 weeks. Patients frequently start feeling better after the first few sessions, around the 3rd or 4th week.
Some people respond earlier, some people respond later.
TMS is a durable treatment, with many recipients never needing a second course.
Think of the brain as a collection of circuits. Essentially, TMS works by plugging into the mood circuit and intervening.
While Dr. Northrup admits any treatment theoretically can have adverse reactions, so far in his practice and from his research, he's not heard of any paradoxical reactions.
TMS was FDA approved in 2008.
It was only in the last roughly 4 years that the third-party payer system has adopted it. There's so much evidence of the efficacy of the treatment that they have to now say, well, this is a valid, useful treatment and we'll pay for it.
It's undeniable now.
And a treatment, no matter how good it is, if it's unaffordable or inaccessible, people just aren't going to know about it. And so that's what's happened in this last few years, is TMS has been around since 2008, but now it's become more widely adopted.
TMS is FDA approved for adults 18 years or older. However, it is used in other ways for children, such as pre-surgical mapping before epilepsy surgery.
TMS is also used for the treatment of PTSD's affective symptoms of depression that are often part of the disorder's presentation.
Rob is a former Special Forces soldier and was one of Dr. Northrup's first patients to use TMS.
He describes his life in depression prior to TMS therapy. Rob was at his lowest point in 2015, experiencing thoughts of self-harm, which led him to seek help.
It was really, really scary. I mean, I'd given my guns to somebody else to hold on to. I wouldn't go out on the balcony because I was on like the 7th story of a condo. So I was avoiding those things because I was in a struggle and I didn't understand it. Things got a little bit worse for me in December 2014, and I had the plan. I had everything. I informed my children of what I was going to do in case they had any questions. I didn't want to leave anything out there. I'd actually accidentally reached out to a friend on Facebook that is a counselor. I was also a Green Beret, and ironically, he forced me to call him the next day by making me promise to call him the next day, and I don't break promises.
After confiding in a friend, they sent him to Dr. Northrup. After therapy sessions, his depression improved, but thoughts of suicide persisted. That's when Dr. Northrup suggested TMS therapy.
Skeptical of the treatment at first, Rob initially thought TMS sounded like crazy voodoo. However, after just a few treatments, he noticed he was no longer having those negative thoughts.
I went ahead and said, sure, we'll give it a shot, and I did the TMS.
Rob decided to test the effectiveness of the treatment by trying to evoke those same negative thoughts he used to have prior to therapy. He found that he was unable to do so.
Actually tried to get myself into a state of depression where I could actually feel suicidal, if that makes sense. Kind of hard to comprehend, but I tried to be depressed, think about bad things, think about friends killing themselves, all those things to try to just put myself in that state, and I couldn't do it. It's nice being normal.
With depression and mood disorders affecting over 16 million Americans, transcranial magnetic stimulation has proven to be one more effective tool in combating this pervasive illness.
Thank you so much for being on the show.
Thank you.
All right.